unlike just about every other disinfecting preparation that's available today on the market for these purposes, this one did not destroy or even harm granulation tissue or normal tissue of any sort, while it was pure murder on single-celled organisms and everything including yeast and fungi. The first time I used it was on a badly infected venous stasis ulcer that was growing out MRSA as well as a Pseudomonas that was pretty much resistant to darn near everything. With a single application of Dermicin, the first thing we noticed was within literally a minute, the underlying tissue turned bright cherry red. When we went back 48 hours later to change the dressing, the green staining from the Pseudomonas was gone. It then took less than 2 weeks to achieve complete healing of a stasis ulcer that started out being close to 1 centimeter deep and measured, maybe 8 or 9 centimeters by 6 centimeters. This was a big one. Dermicin has pretty much astonished us in terms of the rapidity with which we can now address the entire spectrum of wounds, and we see them all. We have everything from burn patients, patients who've had partial amputations, patients with certainly diabetic, atherosclerotic changes and ischemic ulcerations. So far, with all the patients that we've been treating with Dermicin since we found it in Miami, we have not lost once. We consider that we win when the patient maintains all the extremities that he came in with or stays alive. We treat a number of dehisced surgical wounds that come to us following infection with iatrogenic organisms that are wildly insensitive to almost everything. And we get those cleaned up and healed in astonishing times. And that's everything from cesarean section incisions to mastectomies, cholecystectomies, back surgeries, total hip replacement surgeries, total knee replacement surgeries, a couple of craniotomies, and some plastic surgical procedures as well. I've been doing this stuff for 30 years, and I've never seen anything that works as dramatically and remarkably as a superoxided water. The Dermicin has become our favorite adjunct.
And now we're in the process of really trying to get the large venous insufficiency ulcer, as you can see right here, healed up. This problem has been going on for decades with Mr. Guilbeau. He's had several weeks of the Dermicin treatment prior to our second treatment, which was an appligraft. The advantage of the Dermicin in that instance was that it cleaned this wound significantly faster than normal. He really had a lot of infection around this. It cleaned it up quite nicely. It allowed us to then place the appligraft much quicker than normal. We did not have to use significant oral antibiotics, and really this antiseptic killed the bacteria, got his chronic venous insufficiency ulcer to a stage where the appligraft was placed. Now you can see the wound is very nice and in red. You can see granulation tissue certainly is significantly increased. This wound was twice this size in the past. So we're in the midst right now of the healing process.